Next week, the FDA is expected to authorize use of the Pfizer coronavirus vaccine in children as young as 12 years old. That decision could come as early as Wednesday. More than 2,000 young teenagers participated in a study of the vaccine, and the results were promising.
Now parents are faced with the choice. Once approved, will they roll up their children's sleeves? CBS 46's Rob Hughes breaks down the decision facing millions of families.
I just got my second one, and it just felt like, getting your flu shot.
One prick of a needle, and it was over.
It didn't last long.
For 17-year-old Bryn Hubble.
Oh, yeah.
She saw firsthand the impact COVID-19 had on her parents.
And there was one time when my mom was having trouble breathing and had these pains so bad that she thought she was going to have to go to the hospital.
Afraid for her parents' health, getting the vaccine wasn't even a question.
Hi.
The Hubbles view vaccination as a kind of civic duty.
I feel that in getting vaccinated and in getting my children vaccinated, then we're helping others around us.
1, 2, 3.
Some healthcare experts say it's that perspective that will help lift us out of the pandemic.
Oh, done with that.
It's critical to help us stem the tide.
Dr. Jim Fortenberry is the chief medical officer at Children's Healthcare of Atlanta.
Start rolling that arm out
Part of
too.
his responsibility is overseeing a vaccination clinic specifically for underage patients.
All the evidence that we have from the CDC and published scientific literature tells us that the risks are exceedingly low.
But other families aren't so sure.
There's so much talk about, oh, I got my first shot, I got my second shot. It's all over Facebook. I've been vaccinated.
Alrighty, good deal.
People posting their cards and their Band-Aids on their arms.
Laura Watson is a mother of 3, an 18-year-old, a 15-year-old, and a 6-year-old. She says she's not anti-vaccine. In fact, all of her children were vaccinated against polio, MMR, and chickenpox. The difference for her, the long-term impacts of the COVID vaccine have not been studied for decades.
Not one doctor, not one study can tell you in 5 years that this is safe.
Which is why, despite the stigma Watson feels from others who have received the vaccine, she's going to take her chances.
I would take the risk of getting COVID over the unknown risks of a vaccine.
Rob Hughes, CBS 46 News.